3, 2, 1. Thank you. And we're back with the In the KNOVA podcast. I'm here with Coach Matt, and we have with us Dr. Sarah Penkin and Sam DeLand, one of our members here, and we're going to talk a little bit about women's health and fitness and pregnancy, right?
Excellent.
Absolutely.
First, I'd like to start with...
I don't know how to respond to that.
Oh, that sounds right.
Apologies, that was
just kidding. I have nothing to say. I'll probably sit back and listen.
That's fine.
But if you want me to mansplain anything later, I will.
Oh, great.
Just let me know.
I can't wait.
We're into that.
Awesome.
Okay.
Yes.
Let's start out, Sarah, why don't you tell us a little bit about your women's health background as it relates to your chiropractic practice and how you help pregnant women and postpartum
Yes.
women.
So I'm a chiropractor. My husband and I together own Pinnacle Hill Chiropractic in Brighton. When I was in school, I treated my very first pregnant patient. And at that time, I was still in clinic. I didn't really know a whole lot. And my clinician kind of just tossed me into it. And I absolutely loved treating this patient. So when I graduated from school, I decided that that's really what I wanted my specialty to be. So it started as just prenatal care is really where I started. At that time, I hadn't ever done CrossFit. I would, go to the local LA Fitness and kind of like moseyed my way through the gym and really didn't do anything overly productive. But as I got further into practice, I was noticing that I was having all of these pregnant patients come to me, and they would start asking, what can I do for exercise? Can I do more than walk? My OB is telling me that I'm only allowed to walk. I can't lift more than 20 pounds and all of these things.
Yeah.
So ultimately, it gave me more questions than answers that I unfortunately didn't know the answers to. So I really started to dive deep into what was safe during pregnancy, because I believe that as a prenatal care provider, especially somebody who's so movement oriented like a chiropractor, I needed to know the answers to those questions if their OB wasn't able, or midwife wasn't able to give them those answers. Having your OB and your midwife is extremely beneficial. Their job is to keep baby and keep mom healthy and alive. Mm-hmm. I am not qualified to do those things, but I'm very qualified to be able to give answers on movement and what is safe and nutrition and talk a lot about that, because it's just not their OB or midwife specialty. So I really started to dive deep into kind of prenatal care, which led me into postpartum care. I've taken a lot of continuing education courses that have been, CrossFit-based courses, as well as physical therapy-based courses, and it has really driven my specialty to be not just prenatal care, but also postpartum recovery. So now I tell people that my specialty is actually postpartum recovery and prenatal care, because my heart really lies with postpartum recovery. And that's anything from pelvic floor dysfunction, urinary incontinence, getting a mom back to exercise postpartum, because I think that is something that's really important that isn't addressed a ton. And even in a lot of the physical therapy courses I've taken, there's no information on when can you get back to strength training? What is safe? What is appropriate? How do you do that? At 5 weeks and 6 days postpartum, you can't do anything. And then at 6 weeks postpartum, you can do everything, which is not appropriate. Like at 6 weeks postpartum, you shouldn't be running yet. At 6 weeks postpartum, you shouldn't be trying your 1 rep max deadlift. But a lot of people aren't educated on that. So being able to give my patients that information and give gym owners across the city that information so that they can help their athletes to make sure that we're not doing anything that's going to be detrimental to mom is really what I love to do. And that's kind of how my specialty was crafted and was molded. And I think the way that I practice as a postpartum and prenatal based chiropractor is very different than a lot of other providers in town. I promote strength training during pregnancy, and I promote that during their postpartum period. And I have patients that have clean and jerked more than I did not pregnant while they have been pregnant, which I think is awesome. And seeing pregnant moms get PRs early in pregnancy before they even know they're pregnant is super awesome to watch, because then 3 days later, they're like, holy hell, I just got that awesome PR and I was pregnant, which is really exciting. So it's been fun, but that's kind of my story.
Yeah, as working as a trainer, I've seen a handful of different, as a pregnant woman's trainer, I've had a diverse range of experiences based client to client. Mm-hmm. And there's a handful of Sam, Christina, different Christina of pregnant women who've gone through our program. and I've taken some of the pregnancy continuing education courses, but it was always like, although the course says this person is claiming this or telling me they feel fine, I was always like, if it feels okay to you, I would just not, and I never knew, I would not know what to say. Like when Sam, you could talk a little bit about what you went through, from your perspective on pregnancy, but I just remember I didn't know you that well, but I had all at the same time a client who was pregnant. She was having a pretty hard time just existing. I don't think she was as fit as you going into pregnancy, but I was like, I would see Sam train, I'd be like, this girl is either tough as hell, or there's something else going on here that I don't understand between these two clients, and I didn't know what. But so that's why we wanted to have you on. I think we're going to have potentially a couple people maybe pregnant now in the gym. I'm not allowed to say anything.
That's okay.
But
you let them talk.
Thought this would be a good time to prep. Yeah, no.
Absolutely.
No. So Sam, what was kind of give us a debrief on kind of your perspective from when you started training to when you got pregnant to going through the whole process for you?
Yeah, so being a pregnant athlete or CrossFitter was very challenging because there's just a lot of my husband and I relocated here from Tennessee, and there wasn't a lot of trainers or gyms that we went to that were really experienced. They were basically, if it doesn't hurt, you could do it. So there wasn't a whole lot of information for me, and I did whatever was comfortable to my body. And I had done CrossFit for at least 4 years before I got pregnant, and I'd ran half marathons, so I was pretty fit. So I would just do whatever was comfortable for me. And then we moved here, and I knew no one, and the coaches didn't know me. I was 7 months pregnant when I started at KNOVA.
Oh, so you were already pregnant when you started with this. Okay, that's nice.
I was 7 months pregnant when I came to KNOVA. And I remember the coaches just being like, ooh.
Well, because it's so different showing up at 4 months pregnant and kind of just starting to get a belly and being like, I can still move a barbell pretty well. I haven't gained a lot of extra weight yet. I still feel pretty good. And then showing up at 7 months pregnant, you have a full belly and your body is tired and you're getting into your third trimester and you're just like, oh God.
I felt great.
Which is great.
My first half of my pregnancy was really difficult for me, but by the time we had made it here and I had started at KNOVA, I felt great. But I felt like it was challenging for the coaches because they didn't know me. They didn't know my background, and they didn't know that I was truly comfortable. And if I wasn't comfortable, I just wasn't going to do it.
Right.
But
yeah, some of the other girls that have been pregnant with us, or even the class I had, it's we knew they were trying to get pregnant. And hey, it happened. I'm actually pregnant now, so just to let you know. And I'm like, okay, right, based on my education, right now I think you're okay. It's about that third month, right, where we really got to start making some changes. Maybe you guys can fill us in. That was kind of the guidelines, and then we'd also go based on the field, but yeah. So I guess you had a crash course. I just was realizing, I don't remember you not pregnant before you were a member of the gym. But I was like, time has gone by in such a fast fashion in the last couple of years. So,
well, and every woman's experience with pregnancy is vastly different, right? I've never had a baby, but I have two sisters that are now moms, and all of their pregnancies have been so different, and their doctors have told them different things. So
the doctor portion, my OB back home was like, I don't know what you're doing, but I don't know, you shouldn't lift more than 15 pounds. And I was like, well, that's not,
no, thank you.
Okay, but I'm going to. First of all, I lift patients that weigh 400 pounds. I can't not lift more than 15 pounds. This doesn't make sense to me. And then when I moved here, my OB was like, yeah, I don't really know what to tell you. Just, I guess, don't hurt yourself. There wasn't ever any talk about, things that you shouldn't do, based on your abs. There wasn't anything about pelvic floor. They were just kind of don't lift that. And if you do, I don't really know how to help you.
Yeah, and that was basically what a lot of my clients had gotten feedback-wise. And I know at the time when I was, my client, two of them were particularly pregnant, I was, way more freshened up on the information I needed to tell them. So let's go with trimester by trimester, we'll say. Dr. Sarah's recommendations and guidelines, and then your experience, and see where those things line up and just go with it. So first trimester, hey, it's official. Doctor declared me knocked up. Probably not the words he used, but as a trainer, I think that's a technical term.
Cool. So early in or into your first trimester, really not a whole lot is changing just yet. Mom might be really tired. So sometimes not necessarily getting into a CrossFit class or strength training is going to be what she wants to do, but being able to go on a walk and just keep her body moving with that exhaustion will likely be beneficial. A lot of people don't want to get up and do anything, but feel so much better when they are. So even just as a coach, encouraging that mom to just, go on a long walk your dog, go around the block a couple times just to move will be beneficial. So much changes physiologically so early in your pregnancy. So your blood volume doubles, which makes it a little bit harder to breathe because your heart is having to beat faster because you have more blood in your system. So little bits of exercise. So, a standard AMRAP that might not have been so exhausting before can get very exhausting very quickly. So just allowing her to kind of pay attention to how she's feeling early on will be helpful. Something that OBs and midwives tend to say is they don't want you to get your heart rate above 140, I think is what they say. There's no literature to actually support that. So what I tell my patients is let's kind of pay attention to how you feel. I tell them to utilize the talk test. So what the talk test is as long as you can have a conversation with the person beside you while you're exercising, you're probably at a decent pace and you're probably doing pretty well. If you're out for a run or something like that, think about saying the alphabet or counting to 20 or doing something like that so that you can feel that you're not necessarily out of breath, but you can still have that casual conversation, which means that your intensity isn't going to be super high. So that's kind of where everything starts. You can definitely still strength train through your first trimester. You can still run. You can do yoga. The biggest thing they want is you don't want to overheat your body a ton. So if you're doing a run outside and it's 95 degrees, I would probably avoid that. Run in the morning, run at night, try to go to a gym that's going to have some nice air regulation, maybe avoid hot yoga. But other than that, everything in your first trimester, you can pretty much do.
Where do you think that 140 beats per minute heart rate thing came? A lot of the times when you hear things like that, there's always an urban legend that came with it. Where does that start from? Just out of curiosity, if you know.
I really don't know exactly where it started. I think there was probably a paper done back in the day that suggested that this is where you wanted people to stay, and if you didn't stay there, there was some scary, scary thing that happened. But recent literature has proven against that.
Like if you're a nurse practitioner, right? If you just told me, hey, 140 beats per minute, gotta stay under it, I would just go, oh yeah, makes sense. But I'm usually stressed out when I'm at 140 beats or more, so I was like, oh yeah. But I just wondered if you knew where that came from. But.
I've told some moms, so there's some women that have been patients of mine that are kind of intense athletes to begin with. Like they feel like they're only able to accomplish a good workout if they work their ass off. Mm-hmm. So I've kind of told those patients, maybe use your Apple Watch, maybe use, some type of beats per minute system so that you can track if you want to just try to keep your intensity down because you might push it too hard. That's the only time I tell anybody to kind of keep track of that. Most of those athletes kind of know where their heart rate sits when they're getting exhausted as a non-pregnant athlete anyways, so they can kind of compare it, which makes it a little bit easier.
Mm-hmm. So Sam, when you were in trimester 1, what do you remember, good, bad? How did things flow for you?
I had horrible morning, all day sickness. And I was working full time and finishing up my degree. So I didn't have a lot of extra time. I was very tired, but I don't think it was necessarily from being pregnant. And I couldn't eat a whole lot because I was so nauseous. But as far as working out in the gym, I basically would just felt like if I started to get to the point where I couldn't breathe or take a good few deep breaths, then I would just kind of scale it back. I didn't go upside down. I didn't do anything inverted, mainly because I was going to vomit if I did. But there wasn't a whole lot of modifications. I could still do everything on the rig. I could still do all the lifts. I could run if I felt up to it. I still jumped. I didn't really make a whole lot of changes.
Are there any physical, first trimester things you should stop doing, like crunches, sit-ups, things like that, toe to bar type stuff?
I would say early on, you're probably okay.
Unless you feel something?
Unless you feel uncomfortable doing it. Personally, I don't love, crunches to begin with as a core exercise.
I meant like abdominal compression, not crunches per se.
It's not going to do a whole lot. Like the baby's itty bitty at that point, so it's not going to do a whole lot. By the time the baby's starting to grow, you'll likely feel uncomfortable doing some of those things anyways, just because of some compression. But something that you mentioned too is you weren't eating a lot, so you were exhausted because you weren't fueling your body enough, which obviously is not your fault. But that's something to keep in mind too with any pregnant athlete is if their exercise intensity, let's say, is staying the same, they're now still having to eat more. So making sure that they're fueling their body enough and possibly eating a little bit before they work out, making sure that their blood sugar isn't crashing during exercise is just really important too.
So, yeah, telling your wife who doesn't feel good that she needs to eat regardless. Any strategies on that?
I have snacks. I always had snacks in my gym bag.
Snacks are really good, especially when people have morning sickness. OBs are kind of saying, the smaller meals that you can eat, the better it's going to be, and it's just going to help with some of that nausea a little bit.
You're tired because you're not eating. You need to eat something. And then the look that comes back. That's easy. I'll refer to the
It's a
experts.
different podcast.
Yeah, it's a different podcast.
Yeah, but that one
is
is not necessarily my wheelhouse.
Well, have you eaten breakfast today? Grill. Anyway, that's a whole topic. Yeah. Okay. So then, and so with like the clients that I had, that morning sickness stuff, it came and went and ranged, like not even week to week, but like sometimes it'd be several days in a row. Several days perfectly fine and great. Very sick again. I knew one client in particular she struggled at that because I saw her in the morning in a lot of canceled appointments where she'd come in and ride the bike for 10 minutes, be like, nah, we're done. I'm going home.
I gotta move.
Yeah, stuff like that.
Absolutely.
Okay. So we get into second trimester. And it is 3 months?
Yeah, you're kind of around that 13, 14 week period is kind of where your second trimester is going to start. At that point, most moms who are first-time moms don't really have a belly yet. Kind of around that 16 to 18-week mark is where most people start to pop, so they say. So that's kind of when you might start to feel uncomfortable with certain barbell movements. So bringing a barbell, like cleaning a barbell, snatching a barbell, those types of things, just because your belly might start to get in the way. Strength training coaches who specialize in prenatal care, as well as a lot of providers, will say you don't necessarily want to reinforce poor movement mechanics. So once you start to feel like you're pulling the bar around your belly, being able to switch to dumbbells or kettlebells or something single hand is going to be a little bit more appropriate. I have friends and colleagues who have continued to weightlift through their entire pregnancy, belly and all. So you can do no contact snatches, no contact cleans. It's going to be a little bit more challenging for somebody who doesn't do that sport competitively. The only people that I know who have continued to weightlift are competitive weightlifters throughout their pregnancy. So those are kind of the big things. You really want to make sure that if you are going to continue weightlifting, that you're keeping things bilateral. So instead of jerking with one foot back all the time, making sure that you're switching side to side, because a lot of baby position has to do with pelvic alignment. So if you're always doing something on one side, making sure that you're keeping that even throughout pregnancy is going to be ideal. And then kind of around that time is where we start to talk a little bit about doming and coning are kind of buzzwords in the pregnancy world.
Yeah.
So the way that you would see it is, let's say mom is, 25 weeks pregnant is sometimes when you can start to see it. If she lies on her back and she does
her belly.
Yeah, this is her belly. So if she starts to do a crunch, what you'll see is a little, almost like a mountain, that'll kind of present through her midline. That's where her abdominal muscles, so her rectus abdominis, where your six-pack muscles, that's where they're going to start to separate a little bit. And the linea alba, so the line in the middle, is going to thin a little bit, and those two bellies of the muscle are going to start to separate to create more space for the baby. It is 100% a normal variant. 100% of women at 35 weeks pregnant have some type of abdominal separation because it just needs to happen to make room for the baby. So it's not pathologic by any means. And any person that tells you that you can do X to prevent your diastasis during pregnancy is 100% not telling you the truth.
So if you're someone who's pretty lean, pretty muscular, that'd be pretty obvious on the surface level, or
most
is it visually wow, you're.
It depends. It really depends on how well
lean or developed muscle it is?
it actually depends on how well the person can maintain their intra-abdominal pressure, which is very fascinating. So let's say that you were 6 months pregnant, and I just said, okay, I want you to lie on your back. I just want you to do a little crunch up, bring your chin to your chest. You might have domed or coned a little bit, but then if I got you to come back down and I said, okay, this is how I want you to engage your abdomen, and then do it again, it likely wouldn't happen. So that's the big thing that we're looking for. We don't necessarily want to reinforce movement patterns that are giving mom that doming or coning, but if you can cue their deep abdominals well enough and they can perform whatever activity it is without seeing that, that's great, because it means they can still maintain that intra-abdominal pressure appropriately and activate their abdomen in a way that's going to protect their body. Because when you see that doming or coning, it's just like your body can't handle that pressure. So we probably shouldn't do it because mom can't handle that movement. You'll see it like doing crunches or any type of like leg lift type of exercise. You can see it when moms hang from the bar is a big one if they can't maintain it well enough. Sometimes in a plank position, sometimes in ring rows. So really telling mom how to engage appropriately through a ring row is going to be ideal. Like if they're too far back and like they're too far down, so the rings are more on top of them, that's going to give them like a little bit more intra-abdominal pressure. They're going to have to work a little harder. But those are kind of the big things. Normally around that time, I'll tell people to stop doing any major like crunching, repetitive flexion type things.
Yeah.
There's some awesome ways to continue to train your core during pregnancy where you can be in a neutral spine. So like planks are great, bear crawls are great, palif holds, palif presses, farmer carries, farmer holds, like overhead single or overhead lunges, goblet marches, stuff like that. There's a ton that you can do to train your core during pregnancy, so you can still do that.
Intense. So Sam, what do you remember?
The second trimester, so I didn't really start to get a belly until I hit like the beginning of my third trimester. So I really didn't. I did stop swinging. I didn't kip as much anymore.
Oh, that's a good thing to mention.
Yeah, I stopped. If it involved me kipping or really having to work to get to the bar, I stopped that. I stopped toes to bar, just because it wasn't comfortable, because like my belly was. It was there, but it was low, and it just wasn't a good movement, and I could feel it like pulling and stretching. And then anything like GHDs I didn't do, but again, I didn't make a whole lot of modifications for the second trimester.
So at that point, were you still ever feeling sick or like having the bad energy crashes? Or?
No, once I hit my second trimester, I was like, I can eat, and I was great, and then heartburn hit, and then it was just...
Oh boy.
Yeah.
Was that a regular thing, the heartburn?
Every day.
Okay.
I had to sleep in a chair or sitting upright. Like, it was bad.
Is that typical for just all pregnancies, or?
It tends to be pretty common.
It was rough. I was like, I can eat so much. I'm like, I'm not going to throw up in the operating room. It's going to be a great day. And then it was like, oh God. Just laying down at night, the reflux was woof. Okay. And then Nora came out with all the hair, so.
Oh,
that's what they say.
That's the
old wives' tale.
Yeah.
It's true.
All right, so we're progressing our way through this. What's next?
Third trimester.
The third one. This is the good one, right?
So during your third trimester, your energy sometimes starts to decline a little bit again, just because the weight of the baby, the weight of the extra fluid in your body, the weight of the placenta. And by that time, a lot of moms are having some musculoskeletal pain too. If you're really active throughout pregnancy, sometimes it doesn't hit you with any pain, but sometimes people are pretty uncomfortable. So wanting to exercise doesn't necessarily sound appealing to them either. But a lot of the same things, like avoiding any type of kipping motion, trying to make sure that everything is done in a neutral spine. You might feel like deadlifting from the floor in a conventional deadlift stance is uncomfortable because your belly's getting in the way. So switching it to a sumo stance or raising the barbell off of the floor a little bit, tossing it on like some 45-pound plates is going to be a nice alternative so that you're pulling a little bit higher. Like deep squats might not feel as comfortable, so squatting to a box might be a little bit more appropriate. Something when it comes to weight that I forgot to mention, normally during pregnancy, we want to say it is not the time for any type of 1 rep. So we don't want to be forcing the weight, and you should never do something that you think you might fail. It always wants to be like, I can do this and I know I can do this. Mm-hmm. My rule is we don't want you to lift more than 80% of your 1 rep in any type of movement. Automatically, when you get above 80% of your 1 rep, you have to create that Valsalva brace type of mechanic. It automatically happens when anybody gets above 80% of their 1 rep. And what happens is your epiglottis closes, you create more intra-abdominal pressure, and you're pretty much not capable of breathing through that movement anymore. And what that does is it creates a transient drop in blood pressure, in our blood pressure as mom, but we don't know what it does to the baby per se.
Yeah.
So the goal during any type of strength movement during pregnancy is you don't want to hold your breath. So there shouldn't be any bearing down. There shouldn't be that big and holding our breath that way. We want to try to continue to breathe through the entire motion. And if you can't breathe, inhale, exhale through your entire movement, it's too heavy. Your exhale should be on the work. So we're going to inhale on the way into our squat, exhale forcefully, kind of like you're blowing through a straw on the way up, which is going to give you that little bit of core activation, that little bit of that deep core activation. And it'll help protect your pelvic floor better. It'll help train your core, and it'll make sure that you're not lifting anything too heavy.
So in the 3rd trimester, I feel like from what I've seen, when you're in that 7th, 8th, and 9th month, every month now seems noticeably a little more along the way than the ones before. Because probably that 1st and 2nd trimester, it's a more gradual, but 7 months pregnant and then also 8 months pregnant, and then you're holy shit, you can get more pregnant than what you already are. It's how fragile or how delicate are those different stages in that 3rd trimester? How much should we have to modify the training? Is it case by case, or is it clearly 7 months, gotta stop this, 8 months, gotta stop this? No?
It's really case by case, and I'm sure you can speak to this a little bit better, is, you probably felt pretty good through the majority of your pregnancy, and maybe at the end as your belly started to show a little more, some more things were uncomfortable, but yeah, I still don't think a ton has to change.
Was there anything, Sam, that you remember being particularly I absolutely could not do, or really did not enjoy, or avoided?
Rowing was really uncomfortable. Mm-hmm. Especially once I was hitting the 8.5, 9 months, I was this is awful. I don't like it. Yeah. Running was extremely uncomfortable, especially I remember that workout we did in the park at Cobb's Hill. Yeah. That team, we were team ones or whatever, and that was brutal. That was 2 weeks or a week before Nora I actually gave birth. So
and that's what I can't believe you did that workout. I'm pregnant.
Yeah.
That was a tough workout. I don't care who you are.
Yeah.
And the fact you did that's just Sam. You're on the level.
But I mean, the things that really bothered me was picking things up off the ground, and not so much because my belly was so big. It was just the pressure that it would create, in my pelvis, and I was I can't. Even with the running, it was it was always the pressure.
And the running, that's a big thing that a lot of people notice is probably as they get into their 3rd trimester, running starts to get uncomfortable. Your ground reaction forces while you're running at a moderate pace are I don't know what the research is. It's 2.6 to 3.9 times your body weight. So you think about, if you've gained 30, 35 pounds during pregnancy, it's that times a lot. Kind of every time you take a step, which is a lot of pressure on your pelvic floor, which is already kind of in a stressful space because it has the placenta plus extra body fluid plus the baby all on it anyway. So that causes just a lot of discomfort.
I was just going to ask, I know your joints get all gooey to allow for your body to accommodate for the extra, childbearing, whatever. How does that affect running, lifting?
So relaxin is kind of that big thing that everybody talks about. It will help. It helps to loosen the joints essentially so that you have a little bit more mobility so that when it comes time to birth a baby, you can get a baby through your birth canal. However, there's a lot of new research coming out that says that relaxin is not the reason behind musculoskeletal pain. There's a lot of other things that can create musculoskeletal pain during pregnancy, and relaxin is not the culprit. I could get on a soapbox about all of that, but it really isn't going to change a lot when it comes to exercise. You'll likely feel more mobile in the bottom of a squat. You'll feel like you can hinge a little bit better. But other than that, I don't think it really does a whole lot. Oh, something else I would start to avoid are box jumps. I would switch those to step ups or something like that.
Yeah.
Don't do those.
I wouldn't jump because mainly I couldn't see my feet. I can't, if I can't see where I'm landing, I can't jump. So,
Fair.
And I didn't want to fall. I was
that's the big thing is we don't want moms to fall or miss a step and land on their belly or get a little bit scared with something like that.
No.
Same thing with any type of upside down movement or gymnastics type skills. Anything where you could fall, topple over, your blood pressure could drop fast.
So by third trimester or maybe even potentially before, we're going to stop jumping. We're going to stop going upside down.
You can jump. So friends of ours and people we know have done double unders through their entire pregnancy. But if you're doing double unders and you're peeing or having pain or a lot of pelvic pressure, modifying a double under with a single under is not a modification. So
yeah, you're still jumping.
You're still jumping. Even though you're jumping and you're not having as much intra-abdominal pressure, it's not necessarily a modification for a pregnant woman or a postpartum woman who's experiencing symptoms. We don't want any symptoms. Those are kind of we'll call those our yellow, our yellow flags during exercise, like pain, pelvic pressure, pelvic heaviness, urinary incontinence, difficulty breathing, cramping, things like that are just not things that we want. And then red flags are going to be severe shortness of breath, bleeding, just things that seem red flag-ish to begin with.
Are there?
You don't want to do those things. And then you just want to make sure that you let your healthcare provider know if you're noticing stuff like that.
Yeah. Let's say, are there things that you think a pregnant person would probably, maybe they feel fine in the moment, but as their trainer, I should be yeah, you probably shouldn't do this. I'm going to not let you today in class because I think this is a lot of risk. But they're no, I feel fine when I do it. What's the problem? Is there anything I should be aware of? I should help them protect them from themselves at times?
Mainly I would say weight, how much weight you're moving.
So if they're really trying to bust out some heavy stuff.
Even if you're on an assault bike and you're just crushing it, maybe tone it back a little bit, but as long as they can breathe, if anybody is super short of breath and they can't talk and they can't have that conversation, with that talk test, or they're lifting heavy and they probably shouldn't be because it's getting close to that 1 rep, and that doesn't necessarily mean that you can't lift 75% of your 1 rep for 10 reps if you can, but paying attention to how you're fatiguing through that 10 rep is really going to be important too. Because if you're holding your breath at rep 6, then you're getting that transient decrease in blood pressure and there's stuff that's starting to happen. So that means that 75% is still too heavy.
Oh, yeah. Okay. Well, Sam, so did you have problems with back pain or anything or that's one of the stereotypical things I think with pregnant women is their back at times can even labor them up where they have to, I don't know, maybe be in bed rest for or anything. I was wondering maybe being very fit going into pregnancy, I was wondering if that helped you or if you noticed anything like that.
The only time I had pain was the week going into when Nora was born. That's the only time I had any really discomfort and it was looking back now knowing what it was all labor pains.
Yeah,
it was just my body getting ready.
Yeah, so you see stuff like that? Do people, whether they're fit beforehand or maybe they're just more barely do the LA Fitness thing or whatever, level fit or not fit at all, do you see more back pain stuff or what do you, comparing the fit and the non-fit person, I guess is what I'm asking. What do you see there?
I would say that the athletes, especially strength athletes, have way less pain than anybody else, significantly less. Every so often, they might irritate something if they're still pulling from the floor and they might not, they maybe shouldn't be, or if they squatted too low or they did too many lunges. And eventually, your core and your glutes are going to fatigue a little bit, especially because things are starting to get a little bit compromised with baby there. So sometimes there might be a little bit of SI joint irritation, maybe some hip tendinitis, nothing major coming out of the athletes. But a lot of times, especially with people who have sedentary jobs, lots of low back pain, lots of pubic joint pain, hip pain. Those are kind of like the big things that I tend to see. Now that I'm getting more into the postpartum realm, I'm seeing like some urinary incontinence during pregnancy, a lot of like rehab, a lot of exercises, referring to a pelvic floor PT are all really great things to do. So I'll kind of assess them and think if I can treat them in my office with whatever they're coming in, I'll keep them in my office. If I think the referral is necessary, I'll give the referral too. But those are kind of the big things that I see. I tend to see most of my pregnant patients every 2 weeks throughout their pregnancy, and then once a week the last month of pregnancy, because keeping their pelvis mobile and having like a lot of function and a lot of mobility through their pelvis is just going to make birth outcomes better. Mm-hmm. It's going to help keep their pelvis mobile. It's going to help aid in easier childbirth and delivery. There's a new study that just came out. I think it came out in April or May this year. And it's the first study that came out really talking about how, like, I think it says moderate exercise during pregnancy actually helps decrease either your first or second stage of labor. I can't remember exactly what it says. But that's awesome. Like, that's a ton of great information to just encourage women to continue to exercise. And there were some new guidelines that came out in Canada a couple of years ago talking about what the minimum pretty much recommendations were for exercise during pregnancy, and it said that it should include mobility work like yoga, but it should also include resistance training, seeing a pelvic floor therapist, all sorts of things. So that is what the guidelines recommend. And I think that it's really important for OBGYNs and midwives to really have access to that information, because I find that a lot of people who are of childbearing age want to continue to exercise. They want to run, and they just have all of these people who unfortunately don't have the education to tell them what to do because they just don't know. So every time a patient comes to me that was referred to me, let's say from an OBGYN or a midwife who has kind of said, you know, I don't know anything about exercise, like I write them a clinical summary. I say that this is safe. Here are the recommended like exercise guidelines. And I try to give that information out to providers, because if we're not giving it to them, they're never going to know. It's not like they're staying up on the exercise literature. They're staying up on, you know, how to make sure nobody dies. Yeah. You know, those things are obviously much more important. And I understand that that's where their priorities lie. That's completely understandable. But yeah, I kind of see that type of pain stuff. I try to encourage people to exercise. Even if you didn't exercise before pregnancy, I encourage you to be more active during pregnancy. That doesn't mean, you know, starting a CrossFit class, but that could mean like, let's go for a walk. Let's do some squats. Let's do some body weight squats. Hold your jug of milk and do some squats, you know? So
that's what my next question was going to be. Like, all right, boom, I'm pregnant. What do oh crap, I haven't really been in the greatest shape, or maybe I have been working out a little bit. What are some things that I could be doing to make sure the rest of my pregnancy, including labor, I'm like best prepared for? Like, is there any exercise scheme, you know, must do exercise or highly recommended?
Squats are great. So Ina May Gaskin, she's like the grandmother of midwifery. She says that if you do 300 squats a day, every day while you're pregnant, you should have the easiest labor ever.
Good Murph time too.
Yeah. You would have a really good Murph time.
I was doing squats when I went into labor, so.
Which is awesome. You know?
Oh, like literally?
Yes.
Okay.
It was the only position that was comfortable to me in the days leading up to like
were you like doing a deep squat hold because it felt like good, or you were just
I was like
literally
upstairs
doing squats?
And I was so uncomfortable. My back hurt so bad. I was like literally in tears. I was a day past Nora's due date, and I was just like, I can't. So I was just like, I'm just gonna do some squats because that's the only thing that feels good. And then my water broke, and
it's awesome.
Right.
And doing a squat, like a deep squat, opens your pelvic basin something like 30%. So that's why a lot of moms, if they can be in a squat, they want to be in a squat when they deliver a baby. It's awesome. Same thing with being on your like hands and knees in an all fours position. That's going to help open your pelvic basin a little bit. And if you like turn your knees in and turn your feet out, so your feet are like kind of crooked, just like that. That's going to help too.
Is that why they call it the child's pose in yoga?
That's not a position that I have had anybody deliver in.
Oh, just curious.
I have a girlfriend. She delivered in like a Captain Morgan pose with like her foot up on a stool. So like you can do that too. You know, that's obviously if you don't have an epidural. If you have an epidural, you can't do that so much. But yeah, like squats are really great. Anything to keep your pelvis mobile is going to be great. Yeah.
Okay.
What about like postpartum before you're cleared for like any real exercise. I know my sister struggled with this. Her twins are 5 months old, and she's like, my back is killing me. You know, your core is like not necessarily ripped apart, but yeah, it's like tired, and you're like hinged over in a 45-degree angle over a changing table. You're expected to pick up, you know, car seats and hold babies and carry them around and bounce them and, you know, do all the things.
So it's kind of the same thing postpartum is a lot of midwives or OBs are like, okay, well, take it easy. Don't hold anything but your baby. And your baby might weigh like, what, in the first 6 weeks? Tops 10 pounds?
I was going to say anywhere from 5 to 12 pounds.
Yeah, you know.
Infant was born 11 pounds, 7 ounces.
Were you really?
It's a C-section baby. It's too big to fit.
Yeah, no kidding.
You were a big baby.
That's a
You
lot.
think I'd be taller, right?
But yeah, so, you know, they kind of say don't pick up anything other than your baby, but you're likely still moving some laundry baskets. You might have a dog that you need to move. You might have a toddler that is obviously heavier than that. Plus carrying the baby carrier with the baby, trying to put that into the car. So we
Sam,
see.
are you having PTSD right now? Like, oh god.
You're like, oh my god. But those types of things are very kind of detrimental movements to do for a mom who doesn't know how to move appropriately. So during pregnancy, I go through a hip hinge and a proper squat and how to think about keeping your ribs over your hips and how to brace your core appropriately during pregnancy and early postpartum so that we don't have moms blowing out their low backs, putting a baby carrier in their SUV because they've just never been educated on how to move. Or how do I put my baby in my bassinet without my back feeling like it's going to explode? Or how is it safe to pick up my toddler? Can I pick up my toddler? You know, just talking about things like that throughout pregnancy are so beneficial because it at least gives them the education postpartum to be able to say, okay, this is safe for me to do as long as I do it this way so that I'm not injuring myself further. So I really try to do a lot of patient education during pregnancy, but postpartum, it starts with a lot of breath work, teaching a mom how to do a deep core activation. And for anybody watching, doing Kegels is not always the answer. So people can have a tight pelvic floor or let's say a weak pelvic floor for lack of a better term. And sometimes Kegels are really good for one and detrimental for the other. So if you have a tight pelvic floor and you're just continuing to do Kegels, if you think about it like you have a really like active bicep, like doing more bicep curls from an already contracted state just makes no sense. We want to be able to lengthen the muscle and contract it. So that's why belly breaths and breathing is so important because,
Question. I'm not sure I want to know the answer to this. But like, how does a person know if they have a tight or loose pelvic floor?
Sometimes it's really hard to tell. So, symptoms of having...
I mean, like, if I were to, like, bring it up as a topic of concern, like, how would that person evaluate themselves? I don't know.
You can't really evaluate yourself. The gold standard of evaluation is an internal pelvic floor assessment, which is going to be done...
Not by your trainer.
Not by your personal trainer. Very much out of your scope of practice.
Yeah,
I also, as a chiropractor, cannot do that. So a pelvic floor physical therapist is going to be the best person to do that. They are going to be trained to do that. Pretty much what you could say as a trainer is going to be like, have you had any type of pelvic floor symptoms or pelvic floor dysfunction? Most pregnant women have Googled the hell out of that and kind of know what that means. So symptoms of a weak pelvic floor can be urinary incontinence, fecal incontinence. Something during pregnancy and postpartum that not a lot of people really think about is like flatulence incontinence. So like getting to the bottom of a squat and passing gas and being like, oh, I didn't realize that could happen. Things like that. Heaviness in the pelvis. Those tend to be like, that's a symptom more of prolapse of organ, like vaginal prolapse or uterine prolapse or something like that. So paying attention to those types of symptoms tend to kind of relate to a weak pelvic floor. A tight pelvic floor, you can also have incontinence. It doesn't. So incontinence is a hard one to kind of gauge if you have a weak pelvic floor or a tight pelvic floor. Most postpartum moms are like, oh, well, I pee when I do all of these things, so my pelvic floor must be weak, so I'm going to do a million Kegels and nothing changes because that's not what your body needs. Other symptoms of a tight pelvic floor can be like constipation, pain with intercourse or penetration. And a lot of people who haven't had kids have pain with intercourse or penetration and just kind of think that that's something they have to deal with. So if you are watching this and you are experiencing that, please call your local pelvic floor PT because there's people that can help. But those are kind of the big things that we want to look for. But most pregnant or postpartum moms kind of know, like, this is what pelvic floor dysfunction is like. And Google tells them a lot of those things. Dr. Google knows what's up.
What were some of the things for you, like maybe things you didn't expect postpartum or things maybe that end up being very helpful? You know, so if I'm like, hey, I'm about to have a baby, what should I expect? Or what could you warn me about? Or, you know, what advice would you give to somebody that, you know?
Oh, now that I've been through it?
Yeah. Maybe some things that like, hey, these things are going to be hard. I didn't plan on these things being hard. Or this is what I found helped me the most, you know, to get my body back in shape. Or,
well, I can just say, like, going through, like, from the start of pregnancy, like, for me, continuing to be active and staying active was very important. Not like it was a way for me to, like, decompress. It kept me healthy. It kept me, like, I mean, I think it prepared, like, my body was prepared for labor the best that I knew how to prepare it. So I think keeping active, like, during pregnancy really helped me. And if you're active before pregnancy, I think that there's no reason that you can't continue to be active if that's something that helps you. Postpartum was a very difficult and emotional time for me. And I didn't know there were people out here that specialized in postpartum, athletes or CrossFitters, or just, like, I struggled through postpartum because I could do more pregnant than I could do postpartum. And I just couldn't get past that in my mind. And so, like, when I finally got cleared by my doctor, who was like, yeah, sure, just go back doing whatever you're doing. Also the same person that told me I couldn't lift more than 15 pounds. So, like,
yeah. So, like Sarah's example of day 106 or day 107, like, all of a sudden the world changes. Yeah.
So, I mean, I actually went back to the gym probably 5 weeks after I had Nora because I just couldn't sit at home anymore. Like, I just, I had to do something.
Yeah.
And I think my first workout was, like, at 5:30 or 5 a.m. in the morning with just you and I, and it was horrible.
I actually do remember that. Yeah.
It was absolutely terrible. I probably cried for 3 weeks.
Oh, I was just ruthless on it. I said, you better get your ass back in shape. No, I didn't do that.
I don't think you should do that.
I did not do that. I think, if I remember that day, I don't even think we did the workout that was on the board. I think you just kind of...
It was like burpees and thrusters, and I couldn't even get myself into a front squat. Like, I
think we did, like, a modified something. I don't remember that, actually. Yeah.
It was hard. It was very difficult. I would just say, like, know as much as you, like, for me, looking back now, telling people moving forward, like, don't expect so much from yourself. Like, birthing a baby is a whole different kind of workout that it takes a long time to recover from. And I think knowing what I know now, like, I would be less hard on myself and I would listen to my body more and not so much like, well, I could lift this when I was, like, growing a human and I can't even lift half of that.
So I know that, like, the postpartum depression, things like that, the mental side of it is really traumatic for people. Do you think that yours was as bad as it was because of how you were on yourself, or do you think that some of that was more?
I think a lot of it. I mean, so I did have postpartum depression. I didn't know at the time. Like, when I went for my 6 weeks checkup, like, I, like, just unloaded on my poor OB, and she was like, well, I'm really glad that you're talking about it. And I mean, I had, like, really bad postpartum depression, so I think that was part of it. But I think had I not also had the outlet of at least getting back into the gym, I think it would have been a lot worse. But I think you just, for me at least, like, not expecting so much out of myself. And, like, I don't think new moms should really put that pressure on themselves. And everybody is different. Like, I had friends that had babies who were, like, back to, you know, they had a 6-pack, like, 4 months after they had their kid. That wasn't my journey. That wasn't my path. And that's okay.
I think you're pretty close to a
I'm so
6-pack
proud of
you. She's pretty close to a 6-pack now, if I'm not mistaken. I'm just saying. So you did bounce back.
It took me a long time. It took me a long time.
Well, it's got to be hard, though. Sorry to interrupt you, Matt, but I mean, between, like, friends of yours that maybe, like, bounce back quicker, and then society's basically like, oh, you're good now. Just go out and do the thing, and, like, don't forget to get back in those same clothes you wore before you had baby. And...
I think that Instagram is the most detrimental thing to postpartum mental health.
Oh yeah, I'm sure.
For sure. Because you see these personal trainers or people on Instagram who are influencers and they're like, I got my baby body back by doing these 3 exercises and it's so great. And nobody talks about postpartum mental health. And to be honest, it's bull. It's the first thing I talk about when a mom comes in for their first postpartum appointment. And I tell my moms, I want to see you 2 to 4 weeks after you have the baby. 6 weeks is not soon enough at all to be talking about postpartum depression, anxiety, PTSD after birth, like postpartum psychosis, anything like that. It is way too far. So I talk to all my moms if they have any symptoms that are associated with any type of postpartum mental health, anything. I give them a questionnaire. I give them like a mental health postpartum questionnaire, and I give them a card to see some type of mental health therapist or counselor in town. It's the first thing I do because you need to take care of yourself as much as you need to take care of that baby. And that goes for partner too. Like there are so many partners that nobody asks about, and everybody's like, how's the baby? How's the baby? How's the baby? But it has to be how's mom, how's dad, how's other mom, how's partner, how's whoever, to really make sure that the whole family as a unit is doing well. And I think that being able to exercise postpartum is huge, but I find that athletes, especially people who are super active pre-pregnancy, have a really hard time seeing that their body isn't capable of doing the same thing that it could 5.5 weeks ago, which is, it's very amazing the way that the body works, and giving yourself grace in your postpartum return to exercise is so important. And the research tells us that if you push yourself too hard during your postpartum period, it is ultimately detrimental. Like if your core isn't strong enough to be doing complex movements, you could end up with rotator cuff injuries, or you could end up with knee injuries. You could end up with thyroid dysfunction. You can end up with a million other things because you weren't taking that slow process through your postpartum recovery. And talking about like getting your pre-baby body back is also like so tough for women to hear. And I think like Western society and our society in general just pushes people to get back to who they are. And I believe that you are a brand new person. Like you are a mom now. And I think that thinking about who you were pre-pregnancy and thinking about who you are post-pregnancy are just 2 wildly different people. And that's 100% okay. And unfortunately in the US, like we give ankle sprains better care than postpartum moms. And like when we think about that, like that is not okay.
Yeah.
You can have rotator cuff surgery. You can have a knee replacement. You can have all of these things. And you get 6 weeks of rehab, 12 weeks of rehab, depending on what it is. You have a baby. Whether it's a C-section or not, you get nothing.
Yeah.
You stay in the hospital for 24 to 48 hours. You get handed a baby. And they're like, good luck.
That's the scariest thing.
You know, there's a lot of, don't get me wrong, there's a lot of support in the hospital. There's like wonderful nurses and lactation counselors and all sorts of things.
Yeah.
But you're really just handed a baby and you're not taught anything about musculoskeletal health. You're not taught anything about movement. You're not taught about any of that. There's no rehab. There's no core rehabilitation. There's no talking to a pelvic floor PT. A lot of people don't even know what a pelvic floor PT is. A lot of people go to their chiropractor and just get adjusted when they're continuing to have low back pain, and it's not because any joint needs to be manipulated. It's because we need to reprogram the way that your body moves, and we have to talk about strength, and we have to talk about strength training. But there's just not enough people in our community, or really in the country, that know how to do that safely for people. Yeah. And it's really unfortunate because, you know, you were here and you were new to the area and you didn't know that there was people that could help you.
Yeah, I had no idea. But
yeah.
Wow.
Yeah.
Well, yeah, I'm like, wow, there's a lot to that. I'm really glad I can't have babies. I'm going to be honest with you right now. Had I been a woman sitting in this chair, I'd be like, you know what? I don't need kids. That's fine. Talk me out of it, guys. Congratulations. No, I was curious. So, Sam, was there anything in particular when you started to kind of gear back up, where you started to kind of get a little healthier, both mentally and physically, feeling better? Was there anything that really kind of helped you make stepping stones, make jumps? I'd say you're pretty fit again. You're in great shape.
Yeah.
You know, what got you from feeling like, oh my God, to hey, look at me go.
I had to let go. I had to come to terms with where I'm at now, where I was at right after having Nora, and I had to let go of where I came from. So like once I let go and like gave myself grace, like, and really started focusing on where my weaknesses were, like particularly my core, like was just wrecked after Nora. So like I worked really hard to like build that up and really focus on movements that would get me back to it. And
anything in particular movement-wise that you liked?
Everything was really challenging, but like the belly breathing, like really focusing on like bracing my core appropriately. I really took away the belts and anything that like and hit like anything that I could cheat my way through a movement. I got rid of. I like am back to them now because I feel like I can appropriately like brace and I'm better and my core is stronger. But yeah, it was a lot of letting go and a lot of there were tears. There were lots of tears.
I know from times I've been injured, like a couple times I've hurt my back, and we're talking like a couple weeks, and even though in theory I'd be like, I'll be fine eventually. Like I knew in my head, but it emotionally felt horrible. So I can identify with, I really kind of feel, you know,
I mean,
feel for it, because what it feels like to be like, oh my God, am I going to be like this forever? Like, am I, you know, I imagine like when you're coming out of a pregnancy, it's just like a massive injury, more or less, right?
It's like a massive injury with a hormone surge all at the same time.
Yeah. Oh yeah.
And a newborn.
Yeah. Oh, that was.
Oh yeah.
Yeah.
And I was back, like I went right back to work after 6 weeks because I just didn't have the time to take off. So there was a lot happening.
All right. Wow.
Yeah, that's a lot.
I guess that's why you were so tough. Yeah, it made sense now that you were doing you know, cleans and box step-ups at 8.5 months. So are there any exercises in particular that women can be doing that are particularly helpful once they've kind of got to that point of being cleared, feeling good mentally? They can really start, you know, like if you had a top 3 or top 5 movements you'd start doing. I know the breathing and bracing sounded really...
Yep, diaphragmatic breath for sure. I don't tell any of my patients to do Kegels unless they've had an internal pelvic floor assessment because I can't do that, so I don't know what's going on, so I tend not to give that to people. But diaphragmatic breath for sure. Things I've started with recently are like a modified bird dog type of exercise. I think that it's a easier, less stressful on the core type of core exercise. So I'll start with a modification, whether that's like just arms working on breath while they're keeping both of their legs stationary, or slowly like dragging a foot out behind them while keeping it on the floor. Maybe not doing arms, maybe dragging the foot, slowly adding an arm. Super, super simple. A lot of postpartum moms or pregnant moms want to go immediately to a dead bug exercise. I think that that is really one of the more challenging core exercises. I think it's a great exercise, and I think a lot of people who are strong enough can do it and do it effectively. But I think a lot of times for postpartum women, it's given too soon, and maybe they're having some coning, maybe they're having some low back pain, they're just not able to keep that brace appropriately. Bear crawl is an awesome one. So I find that it's one of the easiest positions to get that core bracing, and it's somewhat difficult to make sure you're continuing to breathe through that exercise. So it's a nice way to start to incorporate some breath with some dynamic movement.
Any particular bear crawl? We do
I
a
was
whole bunch
just thinking.
We do a variety of bear crawls.
Back parallel to the ground.
So that's going to be, that one's going to be harder. So I tend to tell people to start with their butt above their shoulders because it's just going to be a little bit easier. If you want to make it a little bit harder, you can do more of like a bear hover where your knees are a little bit closer to the ground. You can even start with a bear hold if you wanted to, and just like take 3 or 4 deep belly breaths at the top of your bear position, come down, repeat. I've really started to give a lot of Palloff presses. Because it's nice because it's not just flexion extension based, it's anti-rotational. So it gives you like those oblique slings. You're going to get a little bit more activation through there. And still same thing, like really working on that belly breath. So like nice big inhale, exhale on the work. Always exhaling on the work.
You do those kneeling or
I tend to start with them standing.
Okay.
And then any type of glute stuff. Like I start with I pretty much start with core and glutes. So whether that's a glute bridge, paying attention to your breath, whether that's a box squat, a banded pull through, banded box squats with band around your knees. Those are kind of the big things that I start with, especially with people who don't have much of an exercise background. Being able to just get their body moving and kind of waking up their core a little bit, waking up their glutes a little bit. I find all of those things to be like some pretty good basic things. And then you can get into some more dynamic movements as they start to get further away from that 6-week period. A big thing is when it comes to any high impact stuff, you really don't want to start until you're at least 12 weeks postpartum. So like jumping rope, running, box jumps, jumping jacks, like those types of things, even though they're great to get your heart rate up, sometimes it's just too much downward pressure and too much force on the pelvic floor when it's not completely healed. It can take up to 12 weeks for soft tissues to completely heal, especially if you had a vaginal delivery or a C-section. Like making sure that you're paying attention to those types of things are going to be important.
Wild stuff.
That's great.
Yeah.
Well, hey, congratulations, Sam. Nora is a wild little monster.
She's so cute.
You said she's almost 2?
Yeah.
It is safe to say that Nora and I have actually played some flip cup together now.
I heard. I heard.
And then she splashed me with the pool when I wasn't looking
I
the
heard
other day
she
as
gave
well.
you knuckles. Did she give you knuckles?
I think she's giving me knuckles now, but she might have been a little.
Cute.
She might have been a little loose, in the, with the knuckle hit.
It's a spicy little one.
It was a lot of flip.
Might have been some punches
a lot
instead.
of flip cup rounds, and I think she was giving them out to everyone. So,
Jealous.
no, but I think it's great. And so congratulations, Sam, on just getting back in shape and look good. Being
It took a long time.
I had a feeling. I knew that it wasn't quite easy. I'd seen some of my clients, some of the other girls, kind of bounce back like unusually quick, and I was like, "Is it normal?" And then I knew that you had struggled, but kudos, though, is what I'm trying to say for just getting through it. I think kind of sharing your story is important for people that are probably going to be in the same situation, whether they think they're in great shape, no, I'll be fine, or they have no idea what's coming. So maybe reference you in the future, I'm sure.
Yeah, I mean, the best thing I could say is give yourself grace, let it go. It takes a long time. It took a long time to get to the point where I could let it go. And, it's really important to know that there are people out there. It's not roses and sunshine and unicorn and rainbows. That wasn't my experience in the postpartum world. I love Nora, and I wouldn't change her for the world, but I also had a very challenging experience, and I think it's important that people know that side exists, because I got a lot of, it's great, it's all fun, and I can go right back into doing everything. And
I've seen a lot of different, I think it's more common that it's not enjoyable, at least in the immediate recovery.
I think we're just hearing more about it now.
I think so too. I think I hear a lot about women who have had hard pregnancies or hard postpartum periods because it's what I do for a living.
Sure.
But when you have a patient coming in who might be the first of her friends to be pregnant, the first of her family in a long time to be pregnant, everybody's like, it's so great, it's so great. And a lot of people keep their struggles internally because they feel like, why do I feel like this is so hard? I was literally built to do this. This is what we all do. Everybody else says it's easy. And I think a lot of other women aren't necessarily as honest as they could be with loved ones, friends, cousins, sisters, whoever, because they think they need to encourage them. And the way to encourage them is to tell them that everything is always fine and it'll be fine. Mm-hmm. But sometimes moms just want to hear the real stuff, And I think that sometimes I struggle telling people how it is and telling people that it's not all sunshine and butterflies. But I think women feel more comfortable knowing that and knowing that it's not all going to be perfect. It's a tough experience.
It's complicated. It's complicated.
Mm-hmm. Absolutely.
There's a saying, I think it's something along the lines of, why would a mother go through the pain of labor? And it's the whole purpose is to give new life. It's so when you're in the business world, they use that as an analogy to why do you go through the labor pains of building your business? Because it gives new life, new opportunities to people. And I always thought that was an interesting analogy, because then I think about oh God, being pregnant looks so uncomfortable. Or you hear the stories of bad postpartum experiences, and well, then you meet the kid, and you're like, well, that's why we went through it. And, you know, I was seeing Nora give me a drunken fist bump. Felt pretty good. You know, so Sam going through those labor pains gave me a confidence boost.
There you go.
But no, so we'll get our trainers here at the gym caught up on as much as we can, you know, but mostly we'll be sending them quick to Sarah. I don't know what to tell you. Talk to Sarah.
Totally fine.
That's his, I like to stay, I'm a big proponent of staying in your lane as far as, you know, professionally, so.
Yeah. I have a lot of patients, or a lot of people that reach out to and they say, hey, like I have a chiropractor I really like who does prenatal work, but they don't do any type of exercise safety during pregnancy. I'm a strength athlete. I do CrossFit. Like, will you see me as well if you co-manage my chiropractic care with that chiropractor? And I'm totally fine doing that as well. Somebody reached out to me recently. Her husband's actually a chiropractor in town. And she's like, hey, like, I go to a CrossFit gym and I really want to make sure that when I get pregnant, I know what I'm doing and I know it's safe. And she's like, are those things that you can help me with? Absolutely.
Yeah.
And we have a full gym on the lower level of our office. So, you know, I'm able to bring my patients down there and be like, hey, let's do some ring rows. Let's put some weight on the bar. Let's, you know, we have a whole set of dumbbells, whole set of kettlebells. Like, we're able to do a lot of stuff. So I'm able to give moms that modification right then and there and don't have to worry about just explaining things when I can literally bring them downstairs and show them exactly what I want them to work on.
Awesome.
Yeah.
Well, people, get out there and make some babies.
Oh, boy.
Or at least practice. All right, this has been In the KNOVA Podcast.